Just wanted to make sure it was working.
Yeah.
I knew.
All right, so Barbara, why don't you go ahead and call us to order then?
Okay, good afternoon. This is the Strategic Planning Committee for Fallbrook Regional Health District on this Wednesday, November 15th at 5:30 p.m. And we can have a roll call. And if you will, Raquel,
Director Murad,
present.
Director Leach,
Unfortunately, Director Leach is absent. He just informed us that he has had a small challenge with his transportation, so he will not be able to join us this evening. So Director Mraz, with your permission, I think, why don't we just do a really quick recap of the discussion items, since we are following up with items that came from the board meeting last week.
Yes, which I did view the hour-and-a-half video. And I was quite impressed with what was going on, and I would appreciate it if you would just go ahead and move forward with that and do a recap.
Okay, so the primary topic was really outlining the district's strategic goals so that we can begin outlining a 3 to 5 year roadmap of strategic planning. From the last board meeting, which was on the 8th of November, the general topics that came out, whether they're called buckets or pillars or whatever we want to call them, there were 2 primary directives or initiatives that the board identified. First was identifying a pathway to bringing clinical medical services to the district.
Yes.
Obviously that's been a goal for a long time, and whether that is urgent care or expansion of primary with extended hours, there was quite a bit of conversation about what that could look like. Primarily, it was, I think, agreed upon that the district would not be the one who's providing that, but that we would contract with a partner to bring that forward.
Right.
Specifically with the potential opportunity of the Tri-City UCSD health option to potentially expand this way. So that is more on the 3 to 5 year development, but the directive was to keep that in mind, to identify the kinds of services or needs that we would want to bring forward, and to keep that conversation active so that we are a very attractive partner to Tri-City and UCSD Health. So really, there's not an immediate set of action steps we do on that other than keeping that conversation viable. Okay, so that was the primary or number 1 pillar. I'm gonna use Mike's, Director Stanisek's language of pillars. The second one really had a lot more to do around the district's launching and continuation of programs and services that have already been started out at the Community Health and Wellness Center. Specifically, we've already seen some initial good results with our diabetes prevention program, that whole lifestyle change set of initiatives where we can start to work on diabetes, hypertension, and obesity. So working on creating and establishing and tracking the metrics for those programs to see how well they're serving the community. That was one of the big programs that there's a lot of support for. Second, we've already just launched our relationship with Palomar Family Counseling for providing mental health services. We're about a month in. I just got the first report from Palomar. They already had 12 clients in the first month.
Good.
Which is pretty good. So we had a little report come back from them. They're gonna start gathering some more data, so we'll be able to bring that forward for the end of Q1 for them, which actually aligns with the end of our calendar year. So we'll be able to start seeing some tentative, realistic data by the start of the calendar year. Then the third real program benchmark that we discussed in the meeting really had to do with that resource navigation. Remember, the board already made a strong commitment to bring on our own community resource navigator. So we'll start seeing reports from Katya's efforts with the community to see what kind of needs people are saying that they need help with, the kind of community members that are reaching out to us.
Mhm.
So those were three of the biggest projects, programs that the district is already doing. So the expectation is that we will bring data and metrics around how those programs are serving the community. And then a subset out of that are what other programs can we bring to the community to serve other unmet needs? We had a conversation around doing a CPR AED conversation. How could we better support those groups that already have potentially an AED that may not be functional? And or to do more additional training on CPR, sidewalk CPR in particular, to those community groups that may be at Ingold Sports Park or the sports park down across the way. So, Teresa's already started investigating some of that and already had a relationship that could potentially come on board for that. So what we'll likely do is bring forward the programs part of this conversation and say, here's what we're already doing. Here's something that we think we can launch in a shorter duration. And here are some future programming that could continue to serve needs. And the idea is that we, the staff, would bring forward an implementation and a set of objectives and methods and metrics that would go with that. Is that a fair capture of that? Okay. And then underneath that was also the continuing conversation of how we will cut the pie of financial support to grants versus MOU partners. Right. And the MOU partners are things that the district would like to have their presence primarily at the wellness center. So programs like the food pantry is bringing forward a nutrition program that might be an ideal partnership for us that would be at the wellness center. So the idea is, how would we MOU that so that it's outside of the grant cycle and can be a stronger partnership, and then the district can be part owner operator of that program.
Right.
Similarly to what we do with Michelle's Place, they have a satellite office there. We don't really run any of the programming, but we can help speak to and advertise those programming more because they're on site.
Right.
So the expectation is, as we look at the district's financial resources being allocated, we know that the amount available to grants may change. So we want to make sure that we're supporting those programs that are crucial through the MOU process. So that will be part of the ongoing conversation to understand what's the board's tolerance for how much we can anticipate giving on what kinds of programs we're more committed to investing in at the wellness center.
Right, and I heard you say we want to make sure that we don't duplicate services.
Correct.
And
Right.
that is really being, very farsighted and cost effective.
Well, and that's been a conversation with the board since I got here. The whole point of the wellness center is not to do something that's being done throughout the community where we're being competitive. We don't need to compete against all the yoga studios or things of that nature, but what services can we bring to the center that makes sense?
And could you address what you see as future conversations with the Foundation for Senior Care and the programs that they're going to develop for the upcoming year and their relationship with the Wellness Center?
Yes, that is a loaded question.
Okay. The reason I ask is because I was under the impression at some point in time that they were going to be working with you to create some kind of extension of services and working with the Wellness Center.
They currently do not have capacity to expand any of their services. I recently had a meeting with them. There are conversations of how the district and the foundation may collaborate more deeply under our umbrella, where maybe some of those programs and services are absorbed by the district.
Yes.
Instead of being operated by the Foundation for Senior Care, because they don't have capacity to be able to run those especially with our shift in potential funding. They're in a point of,
Flux.
yes. It's a good way.
I understand that, and what I'm seeing and noticing, in the medical field right now is at one point in time in the past, there was a case manager on each and every patient. They've gone, the way of the dodo bird.
Yeah.
It's now just all bouncing back and forth. And
One discharge planner for,
exactly, and it would be so good to have that. The patient care advocacy component addressed in going forward with any developments that we have with any entity.
Yeah.
Because if we have a navigator.
Yeah.
Fits right in.
right,
And the physician group, if they have a relationship with us, knowing that we have these programs, could help to create something that would be more receptive. She's probably already on top of it.
Well,
I know
and-
she's already
and we're nodding.
light years ahead.
Teresa and I are nodding because that was very much the intent behind the door-through-door program that the foundation had.
Right,
As you may recall, Grossmont Healthcare District is piloting with the county a rural discharge process where CAL FIRE actually follows up patients who have been discharged from Grossmont Hospital in the more rural area to make sure that those folks are receiving the follow-up care so that they're not bouncing back.
yeah.
Right.
Instead of in the-
So we're in contact with Nick Johnson, who is with CAL FIRE, who became a friend of ours through COVID. And of course, obviously, we have a great relationship with Grossmont Health District to see how that pilot program is working. There is potential if, for example, the foundation and their advocates, the door-through-door program, if they didn't have capacity to expand it, perhaps that's a program that now comes under our wing. And we provide, maybe it's similar to like what they're doing in East County, and CAL FIRE gets supported with us to some extent. Or perhaps because our community and our district is much smaller, that our own navigator is able to make that connection. Especially if it turns out that we have a clinical program that is the Tri-City UCSC program. So that's where I said that's a loaded question
Yeah,
regarding the
I
foundation.
understand, yeah.
But that is a part of the programming that could very well fit under the district's initiatives.
Yeah.
But we're talking to the foundation to see what we might be able to do to facilitate keeping those programs viable in the community. I think they're too important.
I agree with you. I just hope that the negotiations continue to move forward smoothly and that they really have a dedicated game plan for the development and the expansion. And there's key areas for, network development for their services. Because I know I watched this happen, I'm dating myself, but in '93.
Yeah.
And it looked like it was going to happen. You had Fallbrook Hospital and you had Palomar Hospital and you had Tri-City, and Tri-City was working with the university. It looked like it was going to take off, and they contracted with all the doctors here in Fallbrook. And it was to create a physician component, because this is when they were first beginning to deal with the capitation payment arrangements. And then it all went south.
Yeah.
And we had a lot of angry doctors and a lot of hurt feelings, and a lot of litigation that the university was having to deal with because somebody didn't read the fine print, basically.
Yeah. Well, and I think it's such a different environment now.
Yeah.
Tri-City's leadership is significantly different than it was in the past.
I'm aware of the growth and the improvement, because they had to really kind of wait until the old guard stepped down.
Right.
And were open to the new concepts of how to manage medicine, even as much as getting element.
Yeah.
That kind of thing.
So I think we have some opportunity there, that may not have been as readily available previously. And so we're gonna keep all those conversations going. As you may have seen from the last board meeting when LAFCO came and spoke
Yes.
a little bit about the upcoming MSR, I think there's a lot more interest
Yeah.
in those kind of collaborative relationships. So the timing is fortuitous for all of us
Yes.
to start continuing what that partnership could look like. And all of that really falls under, what is a district program and service? What is something that we partner to support versus something that we just grant funding to, but are not really connected with.
Right.
And I think the days of our funding programs that we're not connected to, I think that is evolving away.
Mhm.
It made sense initially
It was,
when,
it was startup money to begin with, and they were
Right.
supposed to get on their own feet.
right, with the district, in 99 contracting the hospital out, it made sense that we took those public funds and put it back into the community via nonprofits. I think now we're at a point where we've seen what the nonprofits can do. We've seen the gaps. And now it's time for the district to be able to help fill in those gaps, by strategically putting our resources in those areas.
Well, that whole field of medicine is going to change dramatically, and it's going to advance very, very quickly in their technology and the way that they deliver services, according to powers that be behind the scenes.
Right.
And it'll be beneficial to everybody. And I hope it happens, but, what they're showing us and what they're actually doing behind the scenes are two different things,
Yeah.
And all we can hope is that the progress that we have progress that will come to perfection. And that the communities can benefit, and we need to work on remembering to deliver the services and educate the community on, again, being your own case manager, your own healthcare advocate, understand, it's like Dr. Oz years ago put out a book, the owner's manual.
Yeah.
And it basically was a beautiful book that educated you on your systems and how your systems work, so that you could have a basic understanding of how your body is put together.
Well, and you're making a perfect point, actually, right now. Teresa and I did a very quick mini internal strategic conversation today, and that concept of health literacy, helping people understand how to be an advocate for your own health, how to ask those questions, what you need to know, the basics at least, on what your health insurance doesn't cover, what it means. Some very basic health literacy, let alone some of the more advanced items. I can definitely see that would be a strong opportunity for the health district to be able to support our community in making those choices for themselves.
Yeah.
Um,
It's education, and let them make their choices.
Right.
And anything that's a specific treatment plan, they have to go to their primary care.
right,
But
we obviously are not physicians, but we
Absolutely.
can absolutely say, these are the kinds of questions you should ask your health provider. Here's the things you need to understand about when they send you with an EOB. Do you know that explanation of benefits? Do you know what that actually means? When they're sending you for this process, none of us actually knows what it means.
It's an accounting
Right,
tab.
the idea of, here's how the basics of the system works.
Right.
I think there's a lot of validity towards that health education. And that was one of the things that was targeted in our Catalyst report, as bringing up that health literacy of the community overall extends the health outcomes of your community.
Right.
So it's a perfect piece.
And
to
what
add in.
happened to the public health nurse that used to come out to the community?
Oh, she's still there.
And do we get updates about, current?
No.
I don't
So-
think they have current information on anything since COVID.
Well-
I mean, it's been a mess.
The public health nurse has a very large caseload. She does come to CCHW still. Anything she's.
Well, they're focused more on mothers and, young children, like it's not,
It's
yeah.
not public health.
Yeah. It's very specific
Yeah.
what they're dealing with.
Yeah.
Yeah.
So I think there's opportunities for us to potentially have a role there, knowing that we're not gonna see a strong, county presence there.
It's just, like I said, it's putting the accountability for your well-being back on the individual so that they can have an understanding of how the body works and where they can go to get information to take corrective measures, etc. Because one of the problems that we had at the hospital was that it was wait until something went wrong and then come in and fix it.
Yeah.
And if you can educate yourself ahead of time and prevent, because then you ensure your wellness. And it's just simple as just knowing what to put in your body
Yeah.
and what not to, and water.
Yeah. So, I mean, those are all parts of the program benchmarks that we'll bring forward to, the strategic planning workshop. That's that kind of final piece.
And I can honestly say that the activity that this district is doing from where it started way back when is phenomenal. It is just phenomenal. We have a crackerjack team. We've got a marvelous program. I think we just have to work on the dynamics of what will continue to make us viable to LAFCO and, special districts, because it's just going to happen that more local government is going to be involved in what we're doing rather than having it come from Sacramento. I think those dynamics are going to change drastically. And it would be better for the communities, because you can't, it's like when we had the managed care director of Fallbrook Hospital, the corporate managed care director was in Tennessee. Well, gee, many Christmas, how are you going to have your fingers on the pulse from sitting on a couch in Tennessee?
Yeah.
You have to be out here. And we were a totally different animal.
Yeah.
We were evolving. And we are now at that phase where we're going to evolve again.
Right.
You can't stop progress. It's just not going to continue.
Well, and we
And
have
we're
that.
positioned appropriately.
Agreed. We're with local board being part of this community, hearing from the community, and then with strong partners that are just slightly outside, we have the opportunity to potentially affect change at county level.
Right.
And that's really where we don't need to worry about state, not that we can do anything with the state. But I don't think we have to worry about a lot of those mandates, because they don't affect the public health component that we're doing here.
Right.
As long as we're relevant to our community and the county to some extent, I think we'll be able to be a strong
We're
partner.
making a difference. It's the main thing. You're
Yes.
making an absolute difference. And I think if Gordon Tinker were still alive today, he'd be ecstatic about what this district is doing, and also the victory with the water district. Because
For sure.
Yeah.
for so many years, I mean, he was back working with Frank Capra when they were doing the movie on the water rights.
Yeah.
I mean, and Frank Capra lived here in Fallbrook. It was a movie.
Which is
director.
why there's capital Will.
Yeah. And so there's a lot of history in Fallbrook that, is still kind of sitting in the wings, but it's been a long continual battle to get these issues, because somebody was thinking ahead going, well, if we're doing this now, what about years from now? And I just wish they'd look at the infrastructure.
You got that right. So I think, so that's a fairly high level overview
Yeah.
of, I think, the strategic goals. I think what I heard from Bill, Chairman Leach.
I listened to the video.
Yeah, I think
And
come January, because we probably will not hold this meeting in December. It'll be right before Christmas, right after the board meeting. So we may not have another strategic planning meeting until that January workshop, which I think is appropriate, because that's where.
There's nothing, we have set out the plan.
Yeah,
We've initiated the action. You're in communication with all the players. All we can do now is wait for progress reports and implementation of the next phase.
yeah.
We've already made those decisions, except for what we talked about this afternoon with regard to the security system.
Oh, yeah, and that's from facilities to board. So the December board meeting will will be busy, obviously. That's where you all have your annual meeting and discussion
And
over
we changed,
committees and all of
We-
that.
we changed positions too. We had.
Potentially,
So-
potentially you all vote
But
amongst yourself.
I would make the recommendation, and I would suggest to our attorney as well. We're working well as we are. And I welcome any changes, but disruption, you don't rock the boat.
The fact that we have two brand new board members and Bill is back after an absence, there's something to be said for having another year of continuity.
Yes, the momentum, the continuity,
Yeah.
and it's team building as well. I
Yeah.
mean, you can see that to hear, I'm sitting at home listening, onto the video of the meeting, and I'm thinking, God, this is just fabulous. Listen to these people. I mean, you really, they all were so perfect in their points and the recommendations, and it was well thought out, and I thought, God, we've got a crackerjack team. I wish we could do some kind of a special wave of our hand to special district to say, this is how you get it done, boys.
Well, I will tell you that, there's a lot of interest of having some of the district's efforts be recognized at either ACHD or CSDA. Raquel and I currently are working on, and we're close to being able to submit for certificate of transparency to CSDA. And that is one of the things Bill's really obviously quite motivated to have. So we'll work towards that. Teresa and I just finished a meeting with Jasmine, our outreach communications, to talk about how we can better tell some of our stories.
Mhm.
So to your point, I think you're gonna start seeing a lot more of our ability to toot our own horn, so to speak, about our successes, so that we are.
Because we are morphing from a hospital owned, or owning a hospital
Right.
district to the wellness center with the plans that we have. And a lot of districts don't have hospitals, and
Right.
and some of them are really kind of scratching their heads as to how are we going to deal with giving services to the community, and I just see us shining. The
Yeah.
efforts that have been put in the work that you are all doing could be a template for some of what they're doing as well.
And I would say from Teresa and Raquel and I, when we went to the ACHD conference this year, you heard a lot of that conversation about those districts that are no longer operating hospitals, how they're redefining what they do to the community. And I think it was pretty fair to say that we were on task or leading on many of those styles of
Yeah.
conversations.
And I think it went from acute care to a focus on health and wellness.
Absolutely.
And now, it's not, we're not coming in after the fact, we're coming in proactively.
Yes.
And
Yes.
because the dynamics are all changing.
Yeah.
It's
So
terrific.
I think our January workshop, we will be able to take these main pillars
Mhm.
and be able to identify some very clear, this is the goal,
Mhm.
and define that 3 to 5 year goal.
Right.
And then once the board has really outlined, those are your top initiatives, your top goals. Obviously, then it comes back to the team to say, here's how we plan to implement. Here's how we can potentially bring the metrics to demonstrate our progress on that.
Absolutely.
So I think that the January workshop, which we're looking at, and I'll confirm with Bill once we're able to get back in communication with him. We're looking at the January 13th date. Yeah, hopefully everything will work out fine with his transportation situation.
Yes. Okay,
So.
well, I think
That's
we've
good.
covered everything. So our board member comments, we'll just put on to be continued, at the next meeting that we have. We have, everything on the website, and, the dates of our other meetings that are coming up for the rest of the month are there as well. And, I thank you all for your work and attention to getting all of this coordinated for our strategic planning, and we'll continue with that strategic planning in our workshop in January. And you're targeting the January 13th date?
We're looking at January 13th. that is again to be determined once I have confirmation from Bill, but so far that seems to be the date that works best for everybody else.
Terrific. All right, well, if there's no further business, I'm good with saying thank you for attending the meeting and adjourn and all a good night and stay
Thank
safe
you.
out there.
Yes, thank you. We
Thank you,
don't,
Margaret.
we don't necessarily mind meeting.